Healthcare, plain and simple. How health insurance works for you. You've probably never thought much about healthcare, and that's okay. It's not the most exciting topic. But imagine if you broke your arm. You would have to get an x-ray. Your doctor might order physical therapy. If you have health insurance, you could end up paying less than $200. That's right. You could pay more for the latest smartphone or game console than for fixing up your broken arm. But what if you didn't have health insurance and had to pay for your treatment on your own? In Hawaii, all your visits to your doctor could end up costing more than $3,000. Yup, that's a big difference. Now imagine if you had an unexpected illness or injury, had a major procedure, or needed an expensive prescription drug. Yes, health insurance helps a lot. As long as the care you receive is covered by insurance, your health plan pays for most of the cost. Depending on what type of coverage you have, you might pay a co-payment or deductible, but your insurance protects you from getting stuck with huge bills that could wreak havoc on your budget. So health insurance is not something we usually think about until we need it. But health insurance is what protects us from paying an arm and a leg if we need more expensive medical treatment. When you need to learn more about how health insurance works for you, go to healthcareplainandsimple.com.
All right, we're going to go ahead and get started. I'm not sure. I think I may have been muted for the first minute of the presentation, so I'm going to go ahead and, if you did not hear this, we are going to answer questions at the end of the presentation. So type your questions as they come up into the question box at the bottom of your GoToMeeting navigator. If you see that questions, it says, if you hit the plus button, it'll give you a space where you can type in a question. You can type it in at any time. It'll accumulate a list, and we'll be reviewing those at the end of the webinar. We've allotted 45 minutes for today's presentation, but it will likely go over 60. And just for some background on why we're doing this presentation, we put it together at the last minute, and we only made it available on Tuesday, I believe, Christina. Mm-hmm. So we actually gave this webinar on Tuesday for the local chamber here in Park City, and the feedback was so outstanding that we decided to go ahead and do it for our partners and our customers. So if you're on the line and you're one of those, thanks for joining. This will be available to you as a recording afterwards. If you're not currently a partner or a employer, hopefully you'll find this information helpful and can consider becoming a customer or a partner of ours as a result of it. I'm not going to do much selling on this webinar. I'm mostly going to be giving you my opinion. But I do have a few things I'll run through at the beginning. I'm just going to check to make sure everyone can hear me on the questions and make sure there's no technical difficulties, and then I'll get into the presentation. All right, it looks like we're good to go, so I'm going to go ahead and get started here. Before I do get started, I have to do a quick disclaimer. I'm going to walk through this presentation, and I'm going to be giving you my opinions on how I see the market, how the market has evolved over the past 10 or so years, and also how I see it evolving over the next year, plus maybe even 10 more years. So we are going, before I get started, just note that this is not intended as legal or tax advice, and that we are, I'm not going to, I do not necessarily represent the employees or affiliates or shareholders of Zane Benefits in my opinions. They may not necessarily share my opinion. But I'll be honest with you on this presentation, and whether you disagree with me or agree with me, hopefully it gives you an insight that you can use in your business or in your personal financial life. So anyway, if you don't recognize my voice, my name is Rick Lindquist. I'm the president of Zane Benefits. I'm going to be giving the entire presentation today. I do have a tendency to get going pretty quickly and get a little bit passionate, so I apologize in advance for that because it's bound to happen. Sorry, but I do get excited about this stuff. So before I get into the agenda and the meat of the presentation, just a little bit about Zane Benefits and me, so you understand where my perspectives are coming from, and hopefully that will help you, take this presentation the right way. So we at Zane Benefits, we were founded in 2006, and we have one single product, and it's called Zane HRA. And we refer to it as the online alternative to group health insurance. And what it basically is a software platform that lets an employer offer a 401k for health benefits. Instead of offering a defined benefit group health insurance plan, we allow employers to get out of the health insurance business and instead give employees a defined contribution amount that they can use to go purchase or reimburse medical care that they purchase on their own, or even their own individual health insurance policy. And that's what we've been doing since 2006. That's the purpose of our founding. So keep that in mind as you hear my views. Obviously, they're going to be influenced by my experiences over the past 6 to 7 years in this model. So if you're wondering what the Zane HRA software is, basically it's what I just talked about, but to go into a little bit more detail, provides 100% paperless administration experience. So we are completely online to employers and insurance professionals that want to offer better benefits without a group health insurance plan, whether that's due to costs or some other issue that is prohibitive with group health insurance. If you want more information, you can check out our website. I'm not going to talk about our software anymore in this presentation. I'm going to make it about healthcare reform. So if you're looking for more information and you attended this to get the software information, you can follow this link or check out zanebenefits.com and click on the software. If you're an employer on the phone, basically what this means to you is you would use this to manage your health benefits plan completely online. The idea is you can do this in less than 5 minutes per month. We do not sell health insurance, so your employees would obtain their own individual policies, and we recommend that you work with one of our partner brokers who will be a resource to your employees to navigate this new world of individual health insurance, this new scary world of being responsible for your own health care. And so we have a large partner network that's made up of over 10,000 licensed agents. None of them are employed by Zane Benefits, but they are what we call our trusted partner network. And so keep in mind, we do not sell health insurance. So if you're a broker on the phone, hopefully you're not feeling threatened by us as a competitive product. Hopefully you're seeing this as a resource. If you want more resources, I'm going to go through a couple. You can always subscribe to our blog at zanebenefits.com/blog. We post a couple of posts every day. Christina, actually, Merhar, who's our marketing manager and content manager, is on the line today, and she is responsible for a lot of that. So if you have feedback on content you want to see or webinars you want to see in the future, email webinars@zanebenefits.com or blog at zanebenefits.com. Okay, that's enough about Zane Benefits. I will say one more thing. These are basically ebooks, free ebooks available on our website, and we're going to cover a lot of stuff today. A lot of stuff that if you're new to these webinars and you haven't attended a Zane Benefits webinar, you probably have not heard before. And so if you want more detail, we have that detail. We're not going to be able to, in 45 minutes, cover all of this. But these are the 4 resources available on our website. Some of these are 10 pages long. Some of them are 50 pages long. But they give you resources with sources and that sort of thing to really get a handle on healthcare reform as it pertains to your business, whether you're an insurance professional or an employer. And then if you're an individual, how on the far right you see this Employees Guide to the Healthcare Reform Tax Credits. It'll actually be very helpful to your employees potentially in understanding how the healthcare reform impacts them. Okay, let's get started. So first agenda item is hopefully we all need to get on the same page with why did the ACA or Obamacare get passed? And I'm not calling, if you're from the left here, I'm not trying to take a political viewpoint on this webinar. I'm going to be very neutral. Hopefully you have no idea by the end of it what my political leanings are, and that would be a great win for me. But I'm going to refer to it as Obamacare because Obama says I could, and he has endorsed this term and likes it, just like Romney Care is endorsed by Romney. So we're going to call it Obamacare, but ACA, Affordable Care Act, it's all the same thing. Once we understand why it got passed, we'll be able to better discuss what you need to know about Obamacare, whether you're an individual employee, a small business owner, an HR person, CFO, insurance professional, CPA, whoever you are on this webinar, and we've got a lot of different people on this webinar, you'll be able to understand what you need to know for you and your family and also your business or profession. The primary things you need to know is this thing called the individual health insurance marketplace. In my opinion, outside of the insurance community, it is unknown and not understood at all by the general public. So if you're an employee on this phone, your employer, I'm going to walk through this, and you're probably going to be thinking, why haven't I heard about this? And it's because, for whatever reason, the administration has not made a big deal out of it. 4, we're going to talk about what is the employer mandate. If you're an employer on the phone and you don't know about this, we'll cover it very quickly. More information, I recommend contacting an insurance professional, CPA, or reading one of our resources that I mentioned earlier. But we'll give a light overview of that. Key thing: if you have less than 50 employees, you are not subject to this employer mandate, so it's irrelevant to you. But if you have 10 employees now, that doesn't mean you're going to have 10 employees later down the road. You may want to grow your business, so you need to be aware of this employer mandate and how it could affect your projected growth if you ever do and desire to be a greater than 50 employee employer. So we'll talk about that. Once we go through the key things, which are the changes to the individual health insurance marketplace and the employer mandate, we'll give you some ideas on how to evaluate your Obamacare options. Now, as I stated, we have a lot of different people on this webinar today. So I'm not going to be able to go to in detail on how you specifically in your situation can evaluate the Obamacare options. I'll give you a detail, but if you want to have a further discussion about it, I'm happy to have that, or one of our staff is happy to have that. I bet your insurance professional would be willing to have that conversation with you too. But we'll provide some resources for you to get more information so you can walk through some worksheets to figure out what this means for you. And then we'll finish with some summary and next steps for you to prepare. A lot of this stuff is taking effect in less than, it's becoming available in less than 3 months and taking effect in just over 6. So if you don't know about this stuff, hopefully we give you the resources to become an expert and be prepared. All right, so why did the ACA or Obamacare get passed? Now, if you've attended Zane webinars before, this is probably a very familiar chart for you. It just actually got updated for 2012 from 2011, so it's got new colors. Instead of the orange and dark blue, it's got dark blue and light blue. So that might be better for you. But if you haven't attended this before, this is going to be a new thing, potentially a new position. So bear with me if you've been on the webinar before. Hopefully you'll like this as a refresher. This is the reason Obamacare got passed. The reason is, and I'm just going to read across the title here, the current employer-based system is not sustainable. I'm just going to repeat that. If you offer group health insurance, or if you offered group health insurance in the past, the rate increases, which I'll walk through in just a second, are not sustainable from a cost perspective for either your business or your employees. That's why Obamacare got passed. It has nothing to do with anything other than the major driving force was health insurance costs too much. The reason for that is healthcare costs too much, which is a completely different issue. But most of the big things that affect you as a business owner or you as an insurance professional are changes to how health insurance is delivered, not to how healthcare is delivered. But let's talk about what's been happening since 1999 before we get into what you need to know. If you are an employer on this phone, if you offered health insurance in 1999, here's what you have gone through. In 1999, the annual cost of a single person for health insurance was $2,196. That's the average cost from this Kaiser study. Oh, a little bit about the data before I walk through it. This is from the Kaiser Family Foundation, KFF.org. They publish an annual benefits survey every year, and they've got data going back to 1999. So they update this chart every year to show the growth of health insurance costs. Look at this. 1999, the average employer-based health insurance cost was $2,196. And in 1999, the average family cost is $5,791. Reasonable, right? Well, let's fast forward 12 years. This is what it was in 2012. We've almost had a 3 times increase in the cost of health insurance. Now, that may be sustainable for some really high-growth businesses, but most likely your business was not able to support this full increase. So What most employers have done, instead of going from 2,196 to 5,615 or 5,791 to 15,745, which is projected to increase to $20,000 in 2014, you haven't absorbed these costs. You've started shifting costs to your employees. So in 1999, let's just say you had a $0 deductible plan, rich benefits, hardly any co-pays. Employees went to the doctor and got stuff and didn't have to pay anything out of pocket. Then you got a rate increase. And instead of going through, instead of doing a rate increase, or just accepting the full rate increase, you said, you know what, I'll take some of the rate increase and I'll shift some of this cost to the employees. That could come in the form of deductibles, increased deductibles. I'm sure the deductibles today that you're offering are not the same you were offering in 1999. It could come in increased coinsurance, increased copays, elimination of copays, and most importantly, in the increase in the share that the employee has to pay of the premium. The problem is, eventually, when you're going up by these increases every year, you're going to have a point where you reach a problem. One of the constraints with especially in the small employer market, with group health insurance or employer-based health insurance, is that the carrier requires the employer to pay at least 50% of the bill. And this is also called a participation requirement. Some carriers require 75% of your employees to participate. Well, as soon as you start shifting costs to employees, employer-sponsored health insurance becomes more costly to the employee, and it becomes less attractive. So employees stop participating in the group health insurance plan. And we call this the death spiral of group health insurance. We've been in it for a lot longer than 1999 with fixes in place, but the real issue here is, as this has happened, employers have stopped offering health insurance. If you're a small business on the phone and you offer health insurance, you are in the minority. Whether you believe it or not, you are. Only 40% of small businesses offer health insurance today. If you go above, in the plus 15 employee category, you're more likely to offer health benefits. But if you have less than 15 employees, it's rare that you would offer health insurance. But good for you if you can do it. But eventually, what's going to happen here is rates are going to go up. You're going to pass enough cost to employees where they go, listen, this isn't for me. They're going to drop off. Guess who drops off? The healthy people drop off. And the healthy people go to the individual market and buy a health insurance plan for less money. What happens? You get rated up even more. That's the death spiral. Anyway, what's happened over the last years is employers have dropped health insurance and shifted the employees to the private market. We call that market the individual health insurance. So forget Obamacare for a second. Pre-Obamacare, before it got passed, the world, or the U.S., was shifting from an employer-based market to an individual-based market. This is very similar to the shift in the retiree benefit space. We shifted from, some of you on the call may remember having pension plans in the old days. I'm too young to ever have experienced that, but if you work for a large employer like Johnson & Johnson, the pension plan may still be around. But you had pension plans, those were defined benefit retiree plans. We have shifted away from those to 401k defined contribution plans, where instead of the employer defining your pension benefit, they give you money in a 401k as a defined contribution and let you manage your own investments. The same thing has been happening pre-Obamacare in the individual health insurance market, where we are shifting to one of employees taking more responsibility, individuals taking more responsibility for their health care versus employers. We call this shift the benefit shift. B2B, first of all, let me take a step back. Health insurance is a consumer product. You don't buy auto insurance. You don't let your employer buy auto insurance for you. So while employer-based health insurance is sold B2B, the actual consumer of the product is an individual. So it's actually a B2C product. The problem is it's not sold B2C, but it's shifting that way. So the benefit shift is shifting health insurance purchases from a B2B world, employer health insurance, to a B2C world where the individual or employee is responsible for their own health care and purchasing their own health insurance, just like they do their auto insurance. So this is the background of why Obamacare got passed. I'm going to check. We may have some technical difficulties. I'm just going to check real fast. Okay, it looks like we're good. I just wanted to make sure we weren't missing anything. Okay, so that's the why. That's my obviously that's my opinion about how things have happened. But if you do the research, you might come to the same conclusion. So what do you need to know about Obamacare? Well, the first thing you need to know is Obamacare didn't get passed to screw a small business. That's just not why it got passed. It got passed because the problem with when I'm going to jump back to the other slide. When this U.S. shift to individual health insurance started occurring, the individual health insurance market didn't exist really. No one bought health insurance in the individual health insurance market. So there's been substantial reforms to the individual health insurance market, but still, if you think about individual health insurance today, compare it to group health insurance, most people have a negative view. I was just on the radio here locally, and I was asking the news broadcaster, hey, what is your perception of an individual policy? And she said, really expensive and not the same benefits as group health insurance. And whether that's true or not is an individual case, but the problem is individual health insurance is not the same thing as group health insurance. Most of Obamacare, what it does is address the problems in the individual market because they said, hey, we see this shift in the health insurance world where most American citizens are one day going to get health insurance on the individual market. We need to pass some regulations to make sure that the individual health insurance market is able to accommodate and treat people fairly. So that's the primary driving force behind Obamacare is healthcare costs, which is a back-end problem, and then supporting this shift from a group health insurance market to an individual health insurance market. And I hope you get that by the end of this webinar. So what are your options come 2014? You have three primary choices regarding health benefits, and this is whether you're a small business or a large business. You can play. You can continue offering group health insurance. As I showed you, it is probably not sustainable for your business to continue doing this over the long term because of costs. Costs are going to potentially keep going up. You're about to see the biggest rate increase in group health insurance that you've seen in a while because of all the new mandates with PPACA or Obamacare. And I'm just telling you this may not be sustainable for you or your employees. But it's an option today, and it may be the best option for you. You need to evaluate it. Second, you can pay. In other words, offer no health benefits at all. And if you are subject to the penalty, meaning you have more than 50 full-time equivalent employees, which we'll walk through later, you have to pay a penalty. But the problem with this solution is, why do we offer health benefits in the first place? It's for recruiting and retention. When you have a prospective employee that you want to get, which we deal with every day, we're a growing company and we need to get the best people, and we need to make sure we have a good benefits package. The reason benefits are valuable is because they're tax-free. $1 in health benefits is worth potentially $2 in pay for the same cost. So it's to the company, and so we want to offer health benefits. So two may not be attractive. So we are going to walk through a third option, which is play differently. It's the offer a defined contribution HRA option or a 401k for health benefits. Now, what you need to keep in mind here is that this option will not get you out of the employer penalty. So if you're a small business, this may be a very good option for you. So for most businesses, option 3 will probably save you and your employees 50% on health insurance. But depending on your size of company, you may need to factor in the penalties of not playing, option number 1, into the overall cost of your defined contribution. For most businesses, especially small businesses, it's going to be substantial savings to just play differently. But depending on your circumstances and your employee situations, which you need to complete a cost analysis, and a great health insurance professional can help you do that, you're going to have to evaluate these things on an annual basis until you play differently. The nice thing about playing differently is that as the employer, you get to fix your costs and set a cap. And you get out of those minimum contribution and minimum participation issues that I mentioned earlier, which is the problem with group health insurance. So hopefully that gives you an idea of what your options are. We'll talk about these as we at the end of the webinar when we evaluate your options. Now, what do you need to know? Here's what you need to know to be able to evaluate your options. You must understand the new individual health insurance marketplaces. Remember, most of the provisions in the Affordable Care Act affect the individual market. They don't affect small businesses. There are minor pieces that affect businesses, like the employer mandate. but most of the impact is on the individual health insurance market when we're talking about health insurance. Second, you got to know the individual tax credits or subsidies. We'll talk about that in just a second. 3, you got to be familiar with the employer mandate. Whether you're a small firm or a large firm, you need to know this just so how it affects you as you grow and add and delete people from your company. So we're going to cover all 3 of these in order, and hopefully you'll get a lot out of it. Oh, before I do get in that, and now I've clearly oversimplified Obamacare, right? I've talked about 3 provisions that you need to know, but there are tons of little minor provisions that have either an indirect effect on you as an insurance professional, employer, employee, whatever. Like, for example, the W-2 reporting requirement. It's a very administrative task that an employer has to do. I'm proposing that these things are minor and by themselves should not impact your overall decision on health benefits. So I'm not going to cover them today, but if you want more information on every specific thing about healthcare reform, we've got a timeline that goes through every single provision that could possibly affect you, as well as a checklist. But these things are not going to majorly impact your decision on whether or not to offer, whether or not to pay or play differently via defined contribution. So I'm leaving them out of the webinar. So the major changes to the individual health insurance market. So this is what healthcare reform does. This is big. Starting January 1st, 2014, the ACA, or Obamacare, equalizes individual and employer health plans. So I mentioned my radio experience where the person I was being interviewed by said, hey, individual health insurance sucks. They can't say that anymore. Starting January 2014, individual health insurance is the same thing as group health insurance, especially in the small group market. It requires guaranteed issue. In other words, one of the problems with individual health insurance today is in most states, and this is 46 states, medical underwriting is allowed. What that does is it allows a health insurance company to reject people that are sick, which makes people have to go to the state risk pool, which works, but it's not as easy for an employee to enter the market because of these medical underwriting requirements. And you could argue, depending on your political viewpoint, that it's unfair that that sick employee has to pay. I'm not taking a position there. I'm just saying there's 2 arguments there. Anyway, the law is the law. It requires guaranteed issue, so medical underwriting is eliminated. So one of the reasons companies offer health insurance today, and they haven't already started playing differently, is because of medical underwriting. You're worried about your employees as an owner. That issue is being addressed by healthcare reform. If you send your employees out to the individual market, they're going to be able to get the same policy that they could get on the group health insurance plan. And excuse the horn, I've got the door open on the patio here in the conference room. So they're going to be able to get the same policy on the individual market that you would get on the employer market. And the beauty of that is an employer can truly address that moral responsibility they have for offering health insurance to their company. So this is a big, big provision. Third, it creates a new state individual health insurance marketplace. Every state has one, and I realize that we probably have 50 different states represented here, so I'm not going to go into specific states, every state. But every state's going to have a marketplace, whether it's federally run or state run, where an employee is going to be able to go purchase individual health insurance. And we'll talk about that in detail. And fourth, this is a big one. It requires virtually all Americans, there are exceptions, such as religious exemptions, to purchase health insurance come 2014. So whether you offer health insurance today or not, your employees, whether they know it or not now, are going to be required to buy health insurance come 2014 or pay a tax penalty. And oftentimes, because of these tax subsidies I'm going to walk you through, if you're offering that employee a defined contribution and they're getting this tax credit, the cost of health insurance is going to be less than their tax penalty. So it's going to make very little sense for them not to buy health insurance if they're educated. So we'll walk through that today. But these are the major things that affect every American and business indirectly. It's the changes to the individual health insurance market. So in order to understand your options, and we're going to walk through right now, you got to understand this new individual health insurance marketplace. So what is the individual health insurance marketplace? You may have heard the term health insurance exchanges. That was a big term when the bill just first got passed. In the actual law, that's what these marketplaces are referred as. In fact, the individual health insurance marketplace is referred to as the American Health Benefits Exchange. So that's where that exchange language comes from. Earlier this year, the Obama administration, the federal government, rebranded the health insurance exchange term as health insurance marketplace because they wanted a new name for it. I'm not going to get into why they did it. The fact is they did it. So if you hear health insurance marketplace, it's the same thing as health insurance exchange, just depending on what verbiage you prefer. I'm going to use health insurance marketplace because that's what everyone else is using who's running these things. And the reason, and I'm going to give, again, let me just say, this is not necessarily my political viewpoint. I'm just going to give you background on what the intention is behind this. So this is the health insurance marketplaces are, on the individual market, are the biggest probably thing that Obamacare is creating. It's the biggest single provision that affects health insurance that Obama is creating. If this fails, his whole health care bill fails. And here's why they think they need a health insurance marketplace. I'm not saying I agree with these, but this is the administration, the crafters of this bill and the people who voted for it opinion of the existing market. One, if you send, and this is a concern many small business owners have, if you send an individual out to the individual market, there are so many different options and so many different, and no standardization across states or plans that it's very hard for an average individual consumer to know whether they're getting a good deal. So they wanted to create individual plan standardization. So one thing the marketplace does is it standardizes individual health insurance products within specific metal tiers. We'll get into that in just a second. So that's one thing they probably want to solve is when you send someone out to the market, there's so many different options, so many different places to buy health insurance. How do I know I'm getting a good deal when I'm not an educated person on the financial aspects of health insurance? Second, and I'm not saying I agree with this. If you're a broker on the phone, please do not take offense to this. There are great brokers out there who provide service. That's why we recommend you to our clients. However, the perception of some members of Congress, you may have heard certain members voice this, and potentially the crafters of this bill is that they wanted to provide a place where someone could compare, an individual, uneducated consumer could compare all options in one place across standardized levels in that unbiased format, meaning they see them all there listed, and they're not listed in a specific order to try to get you to buy one policy. They're not leaning you towards one policy because of whatever reason. It's all there in one place in an unbiased resource. So that's one problem that they are intending to solve. I'm not saying that problem actually exists. I'm just saying that's the thought behind this marketplace. And most importantly, forget the first two because we can address those with a good insurance broker. Number three is the big kicker here. And this is the primary reason health insurance marketplaces have to exist and why they are a big part of this bill. And it's called the Tax Credit or Tax Subsidy Administration. I prefer tax subsidy. I prefer saying tax subsidy to tax credit. I think it's a better example of what happens. And basically what the health insurance marketplace is going to do is it's going to determine the tax subsidy, whether an individual is eligible, number one, for the tax subsidy, and then second, their amount. And we're going to get into who's eligible for tax subsidies later on in the presentation. But the key part is, one, it figures out what the amount is based on the individual circumstances, and it actually does an advance payment. So if I log into the health insurance marketplace and they're comparing all the plans, one may be $500, one may be $300. Let's say I really like that $500 plan, but I can't afford $500 based on my income. The insurance marketplace will let you put in your income, and it will calculate your tax subsidy, which is based on your household size and income. We'll get into that in just a second. Let's just say your tax subsidy in that situation for your circumstances is $300. What it will do, apologize for the siren. If you can hear that siren, someone's in trouble. Let me just let that pass for a second. All right, so the tax subsidy, where was I? Tax subsidy administration. So if I have a premium that I really like of $500 and my tax subsidy is $300, the insurance marketplace will calculate that and show it to me, and it will show me the cost, the true cost of the plan to me, which is $200. Not only that, it will only bill me for the $200. It will actually go to the federal government electronically and get the $300 on my behalf and forward that to the carrier. So the carrier gets the $500, but the individual, me, only has to pay $300. Or I'm sorry, $200 in that case, which is incredible if you don't have the money right then and there. So that's a big, this health insurance tax subsidy administration, which is only available on the individual market, is a big part of this health insurance marketplace. What was that? And the slogan, I've copied this from the administration, is the point of these health insurance marketplaces is to help individuals compare standard individual health insurance options in a single place. So you're probably going, okay, well, go into a little bit more detail about how this health insurance marketplace actually works. We, first of all, before I go into this, I'm going to give you a couple of steps. It's actually really easy. We recommend working through a trusted health insurance professional because they're going to be able to go into some detail that the health insurance marketplaces may not be able to, such as doctor networks and some of the nuances between the different plans within the metallic tiers. So we highly recommend that you work with a health insurance professional and provide that as a resource to your employees if you decide to send people to the individual health insurance marketplace. So, but here's how it would work for an individual. The individual is going to go to his or her state's individual health insurance marketplace website. If you want an example of what this will look like, go to Covered California. It's a really clean, easy website to use. Step 2, the individual is going to complete one of 2 applications. One application, if they want to receive the tax credit or tax subsidy, they're going to fill out a sample, or they're going to fill out one application. It's about 10 pages long, and they'll fill that out, and it will determine their eligibility based on their household for tax credits. If you're above the income threshold, and you know you are, you're not going to qualify for tax credits, you can bypass that application and use a 4-page application and bypass the whole tax credit thing. Depending on your income, you'll fill out one of these applications effectively. Another place where a broker may come in handy or a CPA may come in handy in helping an individual. Step 3, the individual health insurance marketplace will take the application, and if you're eligible for a tax credit, it will display all available plan options within the metallic tiers that I'm about to walk through, and it will show the display cost will factor in the tax credit or tax subsidy that you would get. So where it would say, let's just say it has 5 plans there, you might say 500, 300, 200, 100. It would mark off all those amounts and show you the true price to you factoring in your subsidy. The step 4 is the individual selects the plan. And this is going to ideally be handled if the employee has a computer via online purchase, but it does not have to be. There's paper forms available. Especially if you prefer paper, definitely get a health insurance broker because you may never get done if the broker doesn't help them. Step 5, individual health insurance marketplace bills the individual for his or her portion of the premium, which is, remember, it's the total premium minus the subsidy or tax credit that the employee is receiving. So in that example I gave you, let's just say they pick the $500 premium. They only get billed for $200. They get the value of $500 premium for $200, and the insurance marketplace forwards that payment along with the tax subsidy that they got from the federal government to the carrier. So the carrier gets the $500. Best part about this is if you play differently and you don't just pay, just decide not to offer anything, so you set up a defined contribution, you can reimburse that employee tax-free for the portion that was not subsidized. And we'll walk through this later in the presentation, but at $200 that employee is paying out of pocket, you can give them money to pay for that tax-free or reimburse for that tax-free. So here are some advantages of the individual health insurance market, and you really need to understand these to understand why overnight we may see this, all businesses eventually drop group health insurance. And this may happen over 10 years, it may happen over 5 years, it may happen next year. I'm not giving a timeline here. I'm just saying it's going to happen at the rate we're going. Here are some advantages that the new health insurance market has post-healthcare reform. 1, choice. I'm going to go through real fast. 1, choice. 2, portability. 3, one-stop shop and convenience. And 4, the big kicker, the tax credits or tax subsidies. Choice. So I talked about metallic tiers. So you can see here, individuals are going to be able to choose within these metallic tiers, platinum, gold, silver, and bronze. And the idea is, as the metal value goes up, the higher, the more Cadillac or more better the coverage is, more comprehensive the coverage is. As the metallic level goes down, the lower the premium. So depending on your situation, If you're a young, healthy, single male, you're probably going to be looking at this bronze plan because you want the lowest possible premium because you hardly ever use it. If, on the other hand, you're a family of 4 and you've got some conditions that you need to deal with, and you know you're going to be going to the doctor once a month, it may make more sense to go ahead and pay the higher premium to get the platinum plan so you don't have to worry about shelling out a lot of costs every time you go to the doctor. So depending on your situation, you'll pick which one is best for you. This is where a health insurance professional that you trust comes in, can help you find, based on your risk tolerance, what the best metallic tier is for you. Once you determine the metallic tier, you then will go in and pick plans that all meet the definition of that metallic tier. And you can pick the different combinations of copays, deductibles, coinsurance, and networks that make the best sense for you and your family. Again, within this, that's going to be helpful with a health insurance broker. One employee may want a bronze plan with a HSA deductible. Another person may want a platinum plan with a $0 deductible. So all these combinations will be possible within these different metallic tiers. So that's choice. Contrast this with the traditional employer model, which is you are a 10-person company. You go out and pick the plan every year for all your employees, without regard to what doctor they want to go to or what their risk tolerance is. So the key aspect of this, an advantage of the individual market over group health insurance, is this choice that employees have. Second, portability. Employees are going to be able to take their health insurance with them when they terminate employment. Think about, I like the USB analogy. Remember when USB ports came out, and now they're replaced by Dropbox folders and all these easy things to use to transfer files from one computer to another. Do you want a file that you have to rewrite every time you start on a different computer? No. You want to be able to take that file with you and just improve it as you go. Think about that with health insurance. Today, most people switch jobs once every couple years. That wasn't the case in the old days, but today that's what happens. We're very mobile in the workforce. When you leave a company, right now you lose health insurance, and you have to go through the process of finding health insurance again. The great thing about the individual market is that you can keep your health insurance intact in between jobs. So when you leave one employer, you're not out of luck. You can keep your plan. You don't have to go through the administrative hassle of dealing with this stuff, which is a big, big advantage over the traditional model. And as you as an employer don't have to feel bad about terminating an employee and worrying about their health insurance costs. That's addressed by the new health insurance market reform. 3, one-stop shop / convenience. So one application within this new world is going to get the individual access to all available plan options within the health insurance marketplace and premium tax subsidies. And some brokers are working on an application that goes even further than this and you fill out one application, you see all the different options across the entire market in and outside the health insurance marketplace. So, and the most important thing is the premium tax subsidies. One application gets all the plan options and gets you eligible for these tax subsidies, which are only available on the individual market. And now to the tax subsidies. This is the biggest special incentive. So the whole reason I think the health care reform got passed is to make the individual market more palatable for every American, especially those with less than 400% of the FPL, which, by the way, is the majority of Americans. 400% of the FPL for a family of 4 is approximately $95,000 in 2013, which is most Americans. Here's the thing. That's after your deductions. It's in modified adjusted gross income. So if you're contributing to a 401k and maxing that out between a spouse, your income could potentially be somewhere around $120,000, but after your deductions, you're down in past that $95,000 range. So you could be an over 100K earner on paper and qualify for these tax credits as a family of 4. So this is a big, big deal. An even bigger deal is that they didn't make this available to everyone. They only made it available to people on the individual health insurance market. And they didn't just make it available to the people on the individual health insurance market. They said, if you're going to get this, you have to go to the individual health insurance marketplace that we're creating as part of this bill. So individuals, I'm going to repeat it, I've said it a couple times, can only access the premium tax subsidies through the individual health insurance marketplace operated by the state that you live in. And this is my big point here. If you want your employees to have eligible access to these tax subsidies, and you're an employer, you have to drop coverage. If you don't drop coverage, your coverage could potentially disqualify the employees from the tax credit. So this is where that paying or play differently option may be attractive to you, especially if you're a small business. To just hammer home the point, here's a chart to give you an idea of what this means for you based on maybe your family's income or maybe some of your employees' family income. The tax subsidy we've created a tax subsidy calculator at navigator.zanebenefits.com. Please note that it's in beta phase right now. It's phase 1. We're going to create a full cost analyzer for a business there that lets you really analyze the costs. But the tax credit is there, or tax subsidy calculator is there now. If you want to go after this and find out what your specific situation is or an employee's specific situation is, it'll let you put in specific numbers. But this is the table for 2013. So the two key inputs are household size, so your family size, and then the amount of income you make in your household, and what that is relative to the federal poverty line of that year. FPL stands for federal poverty line. It's set every year by the federal government. 2014 will have a different FPL guideline, so it gets adjusted every year, and it will be higher than this. So all these numbers are conservative compared to next year. So let's just look at the average cost of a single premium in 2012 was, so this is we're taking our Kaiser study. In 2012, the average premium paid by a group employer for group health insurance was $467.92 for an individual. Wow. Remember, they're projecting potentially 50% increases come 2014. So let's just say this average cost is $600 in 2014 for purposes of this discussion. Let's go to our chart. So we're talking about a household size of 1, a single person, with income between $11,000 and $45,000. If they are between this piece, they qualify for a tax credit. So if you are a single person making less than $46,000 in 2013, after your deductions, this is MAGI, M-A-G-I, modified adjusted gross income, you are going to have your health insurance capped as 8% of your income. So the most you have to pay is anywhere from $0 to $363.85, depending on your income. Pretty awesome. At worst case, it's $363 if you're in between this. Remember, we said $600. That's a 50% savings on the individual market when you factor in the tax subsidies. Gets even better for a family. So average group family of 4 premium in 2012 was $13,000. Let's just say it goes up to $2,000 or even $1,800 after the 50% rate increase that everybody's expecting. Let's compare that to the household size of 4. The 100% of the power line is $23,000 up to $24,200. If you're in between these two at your MAGI, your premium cap is anywhere from $0 to $744.75, which compared to the premium in 2012 is 50% savings. It's going to be greater than 50% savings if you're a family post 2014 if rates go up like everybody's expecting them to do. So what I'm trying to portray here is that if you have employees or you personally qualify for a tax credit or tax subsidy, it's probably going to be a better deal on the individual market for you for the same plan that you would get on a group market. So you should probably drop coverage or jump off the individual plan. When you factor in a defined contribution or HRA product, 401k for health benefits, potentially you could give that employee that full $363 or $200 to cover their full premium so that the employee has no out-of-pocket expense. And that could be your health benefit program. We'll get into that in just a second. Just to drive home the point that the administration is really seeing this shift to the individual market, and that's the point of Obamacare. Look at this requirement. So there's a requirement, whether you know this or not, that says by October 1st, 2013, you must notify as an employer all your employees of the individual health insurance marketplace. So starting October, you must provide part-time and full-time employees with a written notice that there's a new health insurance marketplace, and you have to provide a link to the health insurance marketplace website, and that they may have tax subsidies available to them starting this year. You have to send this whether you offer a group health insurance plan or not. Let me go down a little bit. So for details, you can check out this, but the notice must be provided to all employees by October 1st, 2013. If you're looking for the information on this, we've got the information, so email us. We'll help you, or email your health insurance professional. And then every person you hire from then on, you have to send them the same notice. So if you're offering group health insurance, let's just say, and you're sending the employee the notice, they're probably going to go to the marketplace and realize, wow, I could get a better deal on the individual market. And you may be, sorry to say this, screwing them out of a huge tax subsidy because you offer group health insurance. That's not going to be the case in every situation, but it could be the case. And you need to understand what the impact is on the employee financially by offering group health insurance. So there's two templates, one for offering and one for not offering, that you need to be aware of depending on your situation. And this is required for employers that are subject to FLSA. All right, so what's the employer mandate? We've covered the new health insurance marketplaces, and I realize I'm going way over time, but I think this is worth getting all out in one setting. So if you want to jump off, completely understand, this recording will be available. So what is the employer mandate? We've covered the individual health insurance marketplace. We've covered the individual health insurance tax credits. We see the world shifting to individual market since 1999. What's this employer mandate? Well, the employer mandate, first of all, look at this big bold thing. If you have less than 50 employees, it doesn't matter to you. If you ever do have more than 50 employees, it matters. You need to factor the cost in. But it requires certain large employers to pay a tax penalty if health insurance is not offered to employees. In no way does this employer mandate, quote, require a business to offer health insurance. It says if you don't offer health insurance, you're responsible for a tax penalty. But you're only responsible for that tax penalty if an employee receives a tax credit. And we'll get into what that means in just a second. But the key thing is this is only applicable to employers with greater than 50 full-time equivalent employees, FTEs. So FTE, or full-time equivalent employees, is the key variable for the employer mandate. Again, I'm not going to go into detail on specifics. There's a lot of different scenarios that you need to factor in, like seasonal, if you have a seasonal workforce. I'm not going to cover that on this presentation. If you're wondering how to calculate full-time equivalent employees, it is very, very simple. Do not overcomplicate it. FTEs, basically what an FTE is the sum of your full-time employees, which is anyone working more than 30 or more hours a week, plus your full-time equivalent of your part-time employees. So what does that mean? It means basically figuring out the average full-time employee of your part-time employees. So what you do is you factor in there's a separate equation you have to figure out, which is full-time equivalent of part-time employees, which is equal to all your part-time hours worked, and that's all the people that work less than 30 hours a week, add it up and divide it for the month and divide it by 120. And you add that to your full-time to get your FTEs. If your FTE is less than 50, you are not subject to the employer mandate, no penalties. If you are greater than 50 FTEs, you are subject to the employer mandate, but the tax penalty is dependent on other factors. Okay? You are considered a large employer, but you may still not have to pay any tax penalties. So here's an overview of how the tax penalty is calculated. So if you have, I'm just going to repeat this, if you have less than 50 FTEs, you are not subject to this requirement, so ignore this. But if you plan to grow, pay attention. If you have greater than 50 FTEs, your monthly penalty is capped by the following formula. In other words, the most you can possibly pay in a tax penalty per year as a business is approximately equal to the number of full-time employees you have minus 30 times $166.67 per month. This is the max monthly penalty, okay? Here's an example. If you have 60 full-time employees, your max monthly penalty is going to be approximately $5,000. In other words, this is per month, 60 minus 30 times 166.67. If you factor it into a per hour worked piece per day per employee, it's 50 cents per hour per employee worked, which when you look at it on that basis, it's probably not that expensive. So the actual penalty is actually based on whether employees receive tax credit. So this is the max penalty. Just because the penalty is capped there doesn't mean that that's what you're going to pay. It's dependent on how many employees are actually receiving the tax credit. And if no employees receive the tax credit, you've got no penalty, even if you have 1,000 employees and you don't offer health insurance. So that's a key thing to keep in mind. We like to look at the tax penalty as it's really an employer contribution to health care. So remember, you only pay tax credits if employees are receiving, you only pay tax penalties if your employee is receiving the tax subsidies. And the tax subsidies is way more valuable than the tax penalty. Remember, the tax penalty is only $2,000 a year. We're talking about tax subsidies up to $10,000 to $20,000 a year. So you pay a penalty of $2,000, your employee potentially gets a tax subsidy of $20,000 per year. So we like to look at this penalty, if you decide to pay it and not offer group health insurance, as a cost in your health benefits. And I think if you don't offer health insurance, if you do nothing else out of this webinar, write up a sheet that says, hey, I'm going to be paying a penalty come 2014 because I have more than 50 employees, and it's my contribution for your tax credits. And you should take credit for it. Now, we've got a sheet here. Because of time, I'm not going to walk through it, but this is included in some of our resources. And if you watch the recording, you can pause on this plan. But basically, there's a couple of different calculations of the penalty depending on whether or not you offer a group health insurance plan. So I've walked through the new health insurance marketplaces. I've walked through the tax credits. I've shown you why I think we're shifting to an individual market. And I've walked you through the employer mandate. So what do you do with all these things? Well, you need to do some analysis. First, you need to determine if you are subject to the employer mandate. Simple test is, if you have less than 50 employees, you're not. If you have more than 50 employees, you may be. So do the calculation to figure out what your max penalty is going to be. Then complete cost analysis of your three options. You have one option is play. Offer health insurance, pay the bill, and keep doing it. Your costs are going to continue to go up every year, and eventually, in my opinion, you're going to have to drop health insurance. And maybe it's a better option for you today. Second, you can pay. Choose not to offer any group health insurance and pay the penalties. If you can't afford to play differently or play traditionally, this may be the option for you. You may not have any choice. However, you should represent your penalty or the tax credits as a benefit that you're offering. And you should make sure you educate employees and say, hey, I'm not throwing you out to the dust. There's going to be a piece for you. But if you're an employer and you want to recruit and retain employees and you're going to give a raise in the next year, you probably should not pay. You should probably play differently. And that means you still choose not to offer a group health insurance plan. You still pay the penalties if you're subject to them. And you instead offer a defined contribution 401k type plan. And the idea here is you give them, even if it's $50 a month, you give them money as a health benefit so that they value you as an employer. And the reason you would do that is because that $50 you would give them, or $1,000, whatever your budget is tax deductible to the business and tax-free to the employee, which is more valuable than you giving them a raise. So just keep in mind that if you have less than 50 FTEs, no tax penalties, so you don't have to factor that in. If you have greater than or equal to 50 FTEs, you must factor in the cost of the penalties. Once you figure out the cost of paying and pay differently, pick the one that best that saves you the most money or helps saves employees the most money. What's the best deal for you and your company and your employees? Should be pretty cut and dry if you understand the analysis of all three of these options. We have worksheets in this healthcare reform play or pay guide. And so I recommend, if you are interested in evaluating this, you use these worksheets. There's some other great tools online that you can do Google searches for. All right, so I'm coming to the close of the webinar. I went 15 minutes over as usual. I will say that I was interrupted by a couple of sirens and loud trucks, so I'll blame it on that. Here is how I would summarize what we just covered. The core problem and the reason that healthcare reform or Obamacare got passed is not to make small businesses go out of business. It is to address the issue that employer health insurance costs cost way too much. Health insurance costs cost too much. So, and there's, previous to Obamacare, previous to 2014, the individual health insurance marketplace is not on equal footing in most states with the employer market, health insurance market. So starting in 2014, the individual health insurance marketplace is going to allow individuals to compare and purchase standard individual plans that have the same benefits as a group health insurance plan. Employees are only going to be eligible for the tax subsidies if the employer drops coverage. So we've covered the tax subsidies. If you have a lot of employees that fall in those income thresholds after their deductions, make sure you evaluate what the costs are in the individual market. You may find that it's a better deal for you, your employers, you and your employees, to get rid of the coverage and let the employees go get the tax subsidies. So based on what I've walked through in 2014, I believe most businesses will shift or should shift to defined contribution due to the tax subsidies and guaranteed issue. Most small businesses already canceled coverage. Remember, for only 45% of small businesses, depending on the range you do, offer health insurance. So next steps, I recommend get educated on defined contribution, what it is, and the key healthcare reform tax issues. So all the stuff that I talked about today, make sure that you're an expert on. I don't think you need to go worry about necessarily right now the W-2 reporting requirement. That's an add-on task to the bigger analysis you need to do, which involves the health insurance marketplace and the subsidies, the penalties that you may pay if you don't offer coverage, and the tax subsidies that employees can only get on the individual market. And if you decide, here's another next step. If you don't offer health insurance currently and you decide, hey, I can't do either of these, or you decide to transition, start educating your employees about these things. The federal government requires you to tell them about the marketplace and the tax subsidies. Take it a step further and really show them that this individual market in Obamacare could effectively increase their take-home pay by a substantial amount. So we do have additional free resources available on healthcare reform and defined contribution. We will be publishing a kit with all of these available via one download, including this webinar, on Monday morning. So if you want to wait for that, look for a press release on it. We're going to email it out. And, of course, we've got a lot of more of these, and we have more coming out in the next couple of weeks and months. But if you want to get a full download of all these webinars, ebooks, white papers, you can go to zanebenefits.com/healthbenefitsresources. I really appreciate everyone's time. I'm going to stay on the line to answer any questions, like I said I would, for 15 more minutes. But I'm going to go ahead and thank everyone. If you'd like to jump off and you don't have any interesting questions, jump off. We'll get a recording up ASAP. Thank you very much for your time.